Good morning, everyone, and welcome to the WellMed Charitable Foundation's Caregiver Teleconnection. Today, we have a very interesting presentation called Caregiving with Chronic Pain by our dear Lucy and Dr. Jenna Labell. I'm going to tell you a little bit about both these people. Lucy Barylak has a master's degree in social work from McGill University. She's presently working as a consultant or a health network in Montreal, Canada. She's been involved in various research projects and has published numerous articles related to caregiving issues. She has lectured at several universities and colleges on innovative approaches to caregiving, and she presents annually at international and national conferences. Lucy is also a consultant for private industry in the United States, including her work with the WellMed Charitable Foundation and clinics in Texas. In addition, Lucy would like you to know that she was a caregiver for her mother for about 10 years. Jenna Labell received her master's degree in counseling psychology from McGill University in 2017 and is currently in the final year of her doctorate in clinical psychology at the University of Montreal. Prior to pursuing her doctoral degree, Jenna worked as an addiction counselor in an outpatient rehabilitation center, with adults and youth suffering with substance dependence as well as behavioral addictions. Those included cyber addiction, gambling, and sex addiction. She is currently completing her doctoral internship at the Montreal General Hospital in the Allen Edwards Pain Management Unit, where she works with individuals suffering from chronic pain. And that's what they're going to talk about today. So Lucy, Jenna, take it away.
Thank you so much, Evelyn. Welcome, everybody. As Evelyn said, our session today deals with chronic pain, especially caregivers who suffer from chronic pain. So during our 1 hour session, you will have the opportunity to ask questions or make comments. But we want to tell you that once the hour is over, the recording will be closed, and Jenna and I will remain for an additional half hour for anyone who has questions and would like to remain anonymous. So it'll be a nice little time to chat. So before I go on, are there any questions from the audience? Okay. I just want to review a little bit about just caregiving and what caregivers go through. We know that caregiving can be very rewarding. I know that for a fact, caring for my own mother. But caregivers often face numerous challenges and difficulties as they provide care and support to individuals who are in need. These challenges can vary depending on the specific situation, the care recipient's condition, and the caregiver's personal circumstances. Caregiving can be physically and emotionally demanding. Caregivers may experience exhaustion due to the constant physical tasks involved in caregiving, as well as the emotional strain of witnessing the decline or suffering of their loved one. Lack of sleep and self-care can further contribute to that exhaustion. Now, caregiving responsibilities can be time-consuming, often requiring significant amount of time and energy. This can make it challenging for caregivers to maintain a balance between their caregiving duties and other aspects of their lives, such as work, personal relationship, and self-care. Caregiving can impose financial burden on caregivers. They may need to reduce or leave their employment to provide care, resulting in a loss of income and benefit. Additionally, caregiving expenses, such as medical bills, medication, and specialized equipment, can add to the financial strain. Many caregivers really feel isolated and lack adequate support. They may not have access to a network of other caregivers or may find it challenging to ask for help. The lack of support can lead to feelings of being overwhelmed and a sense of loneliness. Caregivers often neglect their own health needs while prioritizing the well-being of the care recipient. This neglect can lead to various health issues, including stress-related illnesses, chronic conditions, and mental health problems like depression and anxiety. So caregivers often find themselves juggling multiple roles and responsibilities. They may have to be a caregiver, a spouse, a partner, an employee at the same time, which can really be overwhelming and stressful. Caregiving can significantly impact relationships, particularly within families. Roles and dynamics may change, leading to conflicts or strain among family members. The caregiver may also feel a sense of loss or frustration if the care recipient's condition affects their ability to even communicate with them, or for their loved one to even recognize who they are. Depending on the care recipient's condition, caregivers may need to perform complex medical or personal care tasks. This requires them to acquire new skills that could be extremely challenging, and managing potential risk factors adding to that burden. So it is difficult to live with chronic pain as well as being a caregiver. I can only imagine. I would like to share an email that I received from a caregiver just a couple of days ago. And it reads, "Dear Lucy, I feel so helpless and hopeless. I'm a caregiver for my mother who suffers from dementia and other medical problems. I'm single and my mother now lives with me. Since she moved into my home, my life has been turned upside down. I love my mother and feel grateful that she is in a safe place. The problem is that I suffer from arthritis and have a lot of pain in my knees. I'm followed by my doctor and take medications, and was told that I have to learn to live with my condition. I do get some relief from time to time, but I feel that since my mother moved in, the pain is constant. Many times I cry myself to sleep and wake up during the night in pain. The pain affects my mood, and I find that I'm very short-tempered with my mother, and then I feel so guilty. I hope that this session today can help me find some relief and what I'm going through. Please help." Well, first of all, I want to thank you so much for your email, and I'm really sorry for all that you're going through this difficult time. And what I've learned personally, that there's not a lot of research done about caregivers who suffer from chronic pain. That's why I'm so thankful and so grateful that we have Jenna with us this morning. So I want to welcome you, Jenna, and I'm really looking forward to your presentation.
Thank you. Thank you very much. So my name is Jenna Labell. I'm finishing up my doctorate degree at the University of Montreal, and I've been working for this past year with individuals who suffer with chronic pain. So I'm working in the psychology department. It's a pain clinic that's multidisciplinary. So meaning people receive medical treatments there from doctors, physiotherapists, nurses, etc. But also there's a psychology team where we work with people one-on-one, and we also run therapeutic support groups. So I'm going to share with you some information today about chronic pain. We're going to tie it in to caregiving. And then we'll talk about some pain management tips at the end. So we can go to the next slide. This is just an overview of today. So we'll define what chronic pain is, and then we'll examine some of the statistics in how much of an issue chronic pain actually is as its own health condition, how many people it actually impacts in North American society. We'll talk about the role of emotions and thoughts in pain and how that actually is a big part of pain management. We'll try to tie it in more specifically to the difficulties of caregiving with chronic pain. And then maybe some things to be mindful of when you're actually caring for a loved one with chronic pain. And finally, we'll take a good chunk of time to review pain management tools. And these will be unique for everyone, in which tools might resonate with you and which ones are feasible or not. And we'll have moments for questions where you can interact with some of the material as we go. So we can go to the next slide. So first of all, what is chronic pain? Acute pain, which is short-term pain, is typically defined as pain that lasts between 3 to 6 months or less. So for example, putting your hand on a stove, immediate pain will go away. and that might be healed in a period of less than 6 months. That's acute pain, short-term pain. Another example would be spraining your finger, healing it with some sort of a device to keep it straight. Eventually, pain goes away and the issue is cured. Chronic pain, however, is typically 3 to 6 months or more. And once you usually are being seen in a specialty pain clinic, it usually is 6 months or more, most likely years, that you've been living with a chronic pain condition. And the thing about chronic pain, it's a condition in and of itself. So oftentimes chronic pain will be present even after an illness or condition has been treated. Pain will continue on for whatever reason, and that will be different for everyone, and sometimes maybe doesn't have a medical answer, which can be really frustrating. So the thing about acute pain is you're looking more for a cure a lot of the times. With chronic pain lasting very much longer than 6 months becomes its own condition. And it's less about finding a cure in certain cases and much more so about learning how to manage pain, learning how to live a good quality of life with pain. So in terms of what's happening in the brain, acute pain, we have sort of an alarm system that goes off in our minds where we feel an immediate pain. Let's say you stub your toe really hard. Your brain sort of releases all these chemicals saying there's a danger, there's a threat, move your toe, hold your toe, do something to help it, and immediately react to the situation. And so your body kind of goes in fight or flight mode, where it's detecting a threat in the environment. And then you take care of whatever that sort of threat has caused pain to your body. With chronic pain, as we've mentioned, it may last there even though there's absolutely no threat, or even sometimes when a condition has already been treated, but pain continues to last. And so what happens is this alarm system continues to go off even though the threat is not present. So a big piece of chronic pain management is learning how to quiet down that alarm system so your body is not in a constant fight or flight situation, and learning how to better manage the pain that you're in. So whereas acute pain is protective and gives you a warning signal of an injury, keeping this alarm system is destructive with chronic pain because it's actually a false alarm, right? Chronic pain in and of itself is not deadly. And so it's sort of teaching your brain to learn that, okay, we have to manage this in some way. The threat isn't actually present. So that's a very brief definition of chronic pain, but I wanted to provide that for you just so we're on the same page of what we're talking about. Very common types of chronic pain, and this is not an exhaustive list, include back pain, joint pain, including osteoarthritis, neck pain, headaches and migraines, which are two separate things, fibromyalgia, so that's widespread pain. Also, some people might suffer from chronic fatigue syndrome, which can have widespread pain, neuropathy, so damage to some nerves in the body. You can have chronic pain following a surgery. So whereas the actual sort of mechanical issue in the body is healed with the surgery, it leaves you in chronic pain following a surgery, also following an accident at times too. And also certain cancers can be painful as well as post-cancer treatment and pain. Some chronic pain is due to a moment in time that something shifts. Maybe you were in an accident, maybe, you hit yourself in some way. Sometimes it's simply through the process of aging. So eventually, everyone will have issues with their spine, right? It can't stay in healthy condition forever. And that may be more degenerative earlier than for others. For others, you might have been born with a condition that leads to chronic pain. Everyone's story is quite different, but all of these together are under the umbrella of a chronic pain condition. So we can go to the next slide. So now we've defined what chronic pain is. Let's look at some of the more qualifying, sort of the qualities and characteristics of what living with chronic pain is like. So chronic pain is actually defined often as, or described as, a silent illness. Sometimes it is very evident, somebody may have multiple sclerosis and maybe has to use some sort of a wheelchair or a walker. Maybe someone uses a cane if they have nerve pain in their leg. those are more obvious indicators to others that there is maybe a person is in pain or has limited mobility. But a lot of times chronic pain is silent, right? Nobody's going to know that you live with a headache, that you live with widespread pain from fibromyalgia, that maybe you have nerve pain in your neck, right? You may be able to walk and talk and look perfectly fine, but inside you're struggling. And so because of that, it can lead to a lot of feelings of isolation. It can also greatly affect a person's quality of life. So whereas someone maybe was able to engage in certain activities before chronic pain or when chronic pain was less severe, maybe has to take a step back from some of those activities, maybe removes themselves from parts of society that they used to be involved in or parts of their community. So it's definitely quality of life is something that we focus on where there is losses with chronic pain, and how can we add back some quality of life now with chronic pain, which we'll go into more detail about shortly. Chronic pain also is accompanied by a lot of grief and loss. Specifically, if there was a moment in time where a person's life changed, right? Maybe from an accident, from a surgery, from an illness that now leads them to have chronic pain. So we see here identity. It's learning who you are now with chronic pain, learning your limitations, learning your boundaries. And so there might be actually a grieving process that happens with who you were and what your body could do before, and maybe who you are now and what that looks like in your day-to-day life. There also is a loss in mobility, perhaps with certain people, that certain movements are no longer feasible, certain sports, maybe even hobbies maybe are no longer feasible for a person. Living with chronic pain can also affect concentration and attention, not just because a lot of your mental energy is being focused on pain, but also because it can lead to issues such as, extreme sadness and even depression, anxiety, worried about your health. You can have health anxiety following chronic pain. And so your attention is not only focused on the pain, but also maybe on worries and sadness associated with this loss that chronic pain can bring. Problem sleeping. Some people may wake up in the night because of chronic pain, and the poorer the quality of your sleep, the more difficult chronic pain is to manage, because sleep is a time where you can regenerate the body, where you can calm the mind, where your body heals itself. And so if sleep is not being properly addressed, that's ultimately going to really affect a person's waking life. We already mentioned that depression, anxiety, extreme anger, and irritability can be a major part of living with chronic pain, and also PTSD, so post-traumatic stress disorder, if the chronic pain came following a very traumatic accident, a negative experience in a hospital. So living with chronic pain is not just about the physical pain, but also all the repercussions it has in your life, and also the ways in which chronic pain started affect your relationship with that pain. Chronic pain can also lead to problems in relationships. So the way in which you are able to spend time with others, be present with others, may shift, especially in the beginning of your journey with managing chronic pain. And some people may or may not be understanding of what's happening for you, which can also lead to a lot of frustrations and might lead to social withdrawal. So people might feel misunderstood in certain pockets of life and want to protect themselves. And that's okay. Maybe there are certain people in your lives that are not on the journey with you in the exact way you need them at that moment in life, but also figuring out how you can reconnect with others as you go through this trajectory of chronic pain. And what does it mean now to connect in this way where your body and mind feel different? And in some, all of this affects your ability to possibly provide caregiving for your loved one, because of the difficulties sleeping, because of the difficulties with mobility. I also skipped over, it may be having difficulties in working, so it could have an effect on your financial stability as well. And so all of this together may cause a big barrier towards you being able to be the caregiver you hope to be. And caregiving in and of itself already comes with so many challenges, as Lucy mentioned. So maybe we'll go to the next slide for now. I'm wondering, I think this is a moment where I'm curious if anyone has questions or thoughts they'd like to share before we move on to the next piece about emotions and chronic pain.
So folks, this is your opportunity to ask questions of an expert, somebody who's been working with folks with chronic pain for not just a while, but studying it for a while too. So if you're on the phone, you can press *6. I have a little website that shows me if somebody's undone their phone. I have Tina Forga. Would you like to speak to us? Oh, looks like you don't have audio. Can you put it into the chat box, Tina, if you want to talk to us? Okay. Ruby Vasquez says, during this process, people have to create their own motivations and push through their pain.
Yeah, I think a big part of this is true, that motivation is a huge piece of what your trajectory with chronic pain is going to look like. And we're actually going to talk about what pushing through pain means, right? In which ways is it appropriate to push through pain? And when do we need to maybe allow ourselves the time to sit with pain and respect our limits? And so ultimately, yeah, it is what you make of it in a way. And specifically more in the line of the emotions and thoughts piece, which we'll talk about shortly. So thank you so much for bringing that point up.
She thanks you.
Thanks. Okay, if there's no more questions, maybe we'll move to the next slide then, and we'll have question period as we continue to go. So just briefly to give you an idea of how many people actually live with chronic pain, now that you know that it's defined as pain lasting 6 months or more. In 2021, the CDC did a survey and estimated about 20.9% of US adults experienced chronic pain. So that's over 50 million people. It's a good chunk of people. It's one of the largest health conditions in North America. If we understand chronic pain as this umbrella of any pain lasting longer than 6 months, instead of breaking it up into different diseases or illnesses. In Canada, 1 in 5 people deal with persistent pain on a daily basis. So that's quite a high number as well. And not only does this impact the individual, but it also is a significant cost to society. So not only the medical system, but also loss of income and productivity. So we see that chronic pain really affects all spheres of society in a big way. And that's why I think it's important that we're talking about it today and raising awareness around it in relation to caregiving. So we can move to the next slide. Okay, so emotions, thoughts, and pain. A lot of people think of pain, and obviously you think of there's something in the body, right? You think of the body first, and that's sort of where the mind goes. But there's a lot of research indicating that our emotional state can affect our pain perception, meaning our awareness and our attention to our pain, and ultimately the severity of the pain we experience. So maybe we'll use the email that we got as an example. So this person was explaining how they live with a chronic pain condition, and ever since the person they're caregiving for, their mother, moved into their house, there's been a lot more stress, difficulty sleeping, and there's been a lot more pain. And so this is a really good example of the way in which a person's emotional state and stress in their environment can increase pain, right? Nothing's happening to the body necessarily, but the experience of increased stress actually has an effect on the way in which we understand and feel our pain. So just in the way that, in the same way that a person can feel pain, you might break your leg and then feel sad. So in that sense, their pain led to an emotional response. The reverse can happen, where an emotional response can actually increase pain. So we know that depression can heighten a person's perception of pain, in the sense that when you're in a much more negative state of mind, you're focusing more maybe on pain, on your losses, on what's missing, on the difficulties of your life. And that actually can increase a lot of tension in your body, stress in your life. And now you're focused solely on the pain, which you might experience as more severe. Whereas a more calm, optimistic attitude, which is a lot easier said than done, can actually make pain feel less intense. So this is not at all to say that pain is not real or in the mind. That's not at all what this is saying. Your pain is real. Your pain also has physical components to it. However, the mind is a really powerful tool that can help manage that pain and mitigate your experience of the pain severity. Not only, can your emotions obviously have an impact on the attention you place on pain, but also physical tension in the body, right? When we're stressed, a lot of the times we tense up in our shoulders, we lock up in certain places, we clench our fists, our stomach maybe drops, we have issues with digestion. So all of that tension can increase physical pain in those areas, especially let's say if you have neck pain and then there's a lot of anxiety and you hold it in your neck, it actually will affect the body in that way. So here we see that thoughts matter, feelings matter, your actions and how you engage with those thoughts and feelings matter in terms of mitigating your pain. And you cannot separate them, as much as we may want to sort of put that piece aside and just focus on the body and let me just find treatments and interventions for the body, which is valid. You can't take the mind and the emotions out of that picture as well. So it's really about how can we best utilize that tool for pain management. We can go to the next slide. So now that we know that emotions and thoughts play a big role in pain perception, in pain severity, what do we do with this? So we ultimately have to find our own ways to relax, and that will look very different for everyone. For some people, relaxing might be really calming the system, taking a breath, maybe alone time, maybe it's taking a bath. For some people, maybe relaxing is going for a walk, maybe engaging in a sport, maybe it's moving the body, depending on your mobility issues, right? It really is going to depend on you, but it's seeking out those things that bring us joy. So it's when we live with chronic pain, it's very easy because the pain is so present in everyday life to focus on that pain, to focus on what we can't do. And with that, it's important to find ways to experience joy, even though pain is still present. So this attitude of I cannot experience joy unless I have 0% pain may not ultimately be very helpful. It's about shifting the mindset and accepting that today I have pain. How can I still bring joy into my life, even though pain is still present? Again, this is much easier said than done and will look very different for everyone. But ultimately, people living with chronic pain can regain a better quality of life depending on their approach they take to pain, which is exactly what someone's comment earlier that they made was stating. It's sort of like, how are you going to go about living with this pain now? And because of the fact that emotions and thoughts play such a large role in pain processing, in pain management, in coping with pain, pain is ultimately best treated from a multidisciplinary approach. So not just from the medical approach, which is extremely important, but also maybe from a dietary approach, maybe changing lifestyle, maybe also from an emotional approach, maybe seeking out psychological help or support, maybe from a physiotherapy perspective, learning how to move the body in different ways, right? So that's why at pain clinics, where that's their specialty, the best approach is from people that work in all different areas of health and psychology. So let's go to the next slide. Now that we've covered this topic, any thoughts come to mind or questions about that?
Anybody have any? I've got a little website. I can see if you unmute your phone by pressing *6, or if you want to use the chat room, put your hand up, or just unmute yourself. We would love to hear from you.
I was just to give people a time to think about it. Oh, I see somebody. Okay, I'll wait. There's something in the chat.
Yes, we finally got something from Tina. Thank you, Tina. She says, I work in my flower garden. Isn't that nice?
Yeah, you're not the first to tell me that for sure. I think gardening is such a relaxing activity. And when you feel able to engage in that, that's amazing that you have that to sort of take your mind off things.
No,
Right.
what I was thinking about, it's so interesting. When you have a pain, you want relief like immediately. And as you said, yes, the physical part of it is so important. And many times we want to get a pill or something to reduce that pain. So what I find very interesting about that and thought-provoking is the whole idea is what you were saying, that it's really how that the mind, how we ourselves takes charge and try to find joy in our daily lives, even with pain.
And Chuck Taylor would like to talk to you.
Sure.
Hi.
Hi.
Yeah, I have a lot of chronic pain. I won't go into that, but you know, when you said you know, ways to relax, I recently I'm like the list master. I make lists of everything. And that helps with the cognitive issues and the brain fog and all that.
Yeah.
Somebody asked me, have you ever made a self-care list? What? So I made one and I've got 45 things on it already, but those are things that I can go to the list and look at to do to get, you know, relief of some type, you know, whether it's physical or cognitive. And then the other thing you said, you know, easier said than done. Well, there's an old saying, that practice makes perfect. That's not true. Practice makes permanent. And the more I practice reprocessing these things and taking my mind off of the pain, it's kind of like the muscle memory, you know, for an athlete, the physical muscle, but also the brain is a muscle, so to speak. And it will develop memory the more I practice these self-care things and reprocessing, and eventually lessen what I'm perceiving or the amount of pain I'm perceiving.
How wonderful for you. That sounds great.
Thank you so much for sharing that. I really appreciate that you brought up a self-care list, because I've sat with so many patients and written out those lists with them. And it's amazing how we can think of these tools that we have at our fingertips that might be helpful for us. And so if number one doesn't work, you go to number two. And if number two is not doing it, you go to number three, and whatever that is. So 45, I think that's the longest list I've heard of so far, but that's amazing. So yeah, it definitely resonated with me. And I think it's very important that what you mentioned about practice is that these things do take effort, and these things do take repetitive engagement with certain activities and behaviors so that it becomes more automatic.
You are an inspiration, Chuck.
Jenna, you have time to hear two more chats, or you want to move on?
Yeah, we'll take these two and then we'll go to the next slide.
Okay. Julia says, so true how you approach your pain. I lived with pain since 1979. Full-time and spiritual relief helps me to cope. The joy of caring for someone worse than me.
Yeah, that's so powerful that you found your tools that resonate with you, not only on a physical level, but a spiritual, emotional level as well. And that ultimately allow you to take care of those around you in your life. That's great.
Yes. And Ruby says, simple walks in the park, if possible, or even a drive, make a difference. Changing the scene rather than staying locked up inside.
100%. You are reading my mind. I've said to many different people, you know, on days when you feel less pain, you're still going to have pain. What's the difference if you have pain in your home versus in the park or taking a trip? Some people will book themselves a trip to the beach, right? This is something you have to live with, right? And that you have to ultimately learn to work with. And so if it's feasible, not only financially, but physically, learning to change your scenery with pain allows you to experience new, you know, just new experiences bring joy. And so I think that's really the take-home message with that. Thank you for sharing. Okay, let's move to the next slide. Thank you. So let's talk a little bit about the difficulties of caregiving with chronic pain. So firstly, we discussed that living with chronic pain can be isolating, and it might even be isolating from the person you're caring for. That person may not fully understand your pain condition. They may not be able to fully, even cognitively, may not have the abilities if they're living with dementia or whatever it may be, may not have the cognitive capacities to understand if you're in a pain crisis, if your pain is heightened on a given day. Why can't you engage with them in the same way you were before? Why can't you take them to their appointment today? So it's difficult to navigate that piece as well. Tying that into feeling misunderstood can be by others in your life, but also by the person you're caring for. Caregiving with chronic pain also might lead to inability to fulfill certain responsibilities that you used to before pain was as severe, before you had pain altogether. And so that may be at work, that may be at home, that may be with child rearing, but also with caregiving. So what does it mean now to caregive with this chronic pain, and how might that look differently? And losing a sense of independence. You know, it may be as simple as before you were able to reach up on the top shelf to get the cereal, and that might not be feasible anymore if you have a shoulder injury or if a neck injury or whatever it might be. And so is that maybe in those moments it's asking for help? Maybe it's moving that cereal box and readjusting things to your chronic pain. But I'm giving a small example here. It might be losing independence in a very large way, maybe no longer able to work in what you used to work in, maybe no longer able to be the main person that always is present for your loved one that you're caregiving for. Maybe you need a little bit extra help, whether that be through social services, whether that be through peers and other family members, not only to help yourself, but to help the person you're caring for. Guilt and shame. This was actually brought up in the email that we received, that this person was feeling a lot of guilt and a lot of shame in not being able to fulfill their responsibilities as much anymore, but also in that they were more irritable with the person they were caregiving for, had less patience. And so this can bring on a whole slew of negative emotions, such as guilt and shame. And it's learning about how to be kind to yourself in those moments, and maybe how to readjust tasks in order to make them more feasible for you. Frustration, irritability, changes in mood can all be a piece of caregiving with chronic pain at any given moment. And also learning when to prioritize yourself versus your loved one can be extremely difficult. So whereas your loved one may need attention in a specific moment, that moment might coincide with a big pain crisis for you, right? So that means an increase in pain in a given day or in a given hour. And so, you know, there's the example of, or the saying, when you're on an airplane, you know, put your oxygen mask on first before someone else's. That might actually be really appropriate in a pain crisis or when your pain is heightened, because if you try to help that other person in that moment, you may actually make your situation worse. You might heighten pain, and you might actually really injure yourself or become a version of yourself that's so irritable and upset, in which maybe you can avoid if you take a moment to breathe. So advocating for yourself is another difficulty that might come up being a caregiver with chronic pain. You may have to advocate for yourself with your loved one and saying that, you know, today I can only do this, or today we can only go out for this long, or whatever the case may be. It might be with your peers, but also with your medical team, right? Advocating for yourself that your pain isn't well managed, or that you maybe want more of a multidisciplinary approach, meaning maybe you want to see a psychologist and not just a doctor. Maybe you notice that you need a little extra support. So this piece can be challenging and difficult because you have to stand up for yourself in a given moment, but advocating for yourself may ultimately be difficult, but pay off in the long run. And lastly, asking for support. So whether that be from people that can help you with your caregiving tasks, or whether that means asking for support in your own pain journey, this is a piece that actually takes a lot of courage and strength to do. So we can go to the next slide for now. Thank you. So what do we do if we're caring for a loved one with chronic pain? So now maybe things we should be mindful of if our loved one is living with chronic pain. So as much as you need to advocate for yourself if you're living with a chronic pain condition, you may have to advocate for your loved one. So you may need to be there in medical appointments saying, you know, I've noticed this person is really, their pain is not well managed. They really experience heightened pain at night. I don't know what to do for them anymore. Is there a specialist they can see? Is there anything more we should be doing? That might be a piece of you actually caring for your loved one. Ensuring their pain condition is being managed by doctors and specialists. So again, this is a piece of advocating that maybe there needs to be a little bit more of a team if pain is really not being managed well over time. And that might mean seeking out extra help than you thought you might have needed. Being present for your loved one in a pain crisis. So learning what your loved one needs when pain is heightened. Is it that heating pads help and you can be there to heat those up and give them to them? Is it that, you know, fresh air helps? Is it a bath that helps? Is it a specific medication that the doctor has prescribed that in a heightened moment you administer for them, you give to them? So just knowing what are the unique tools and coping mechanisms for the person you're caring for so that you can actually help them in a pain crisis to manage and reduce that pain. Also, in moments where your loved one is experiencing a better day or a better hour or where pain is more manageable, encouraging them to engage in activities that bring them joy when it's tolerable. So in moments where they're able to do more, you know, encouraging them to socialize, encouraging them to leave the house, encouraging them to experience new things like a walk in the park or whatever that might be for them, because you know that in other moments they will be more debilitated and won't be able to take advantage of that time. So sort of being like a little cheerleader when it's appropriate and when they tell you they can handle it. And also monitoring their mood and emotional state. So as much as we're focusing on how to tackle pain and how to be there in a pain crisis, it's also about checking in with them. How is their mood? Are they feeling more depressed? Are they more irritable than usual? Are they anxious, right? And that, always keeping that in mind as a part of managing their chronic pain. And so maybe advocating for them to get extra psychological support, or doing more things that bring them some joy and some mental relief is also something that we can't forget. Let's go to the next slide, please. We'll pause here for any thoughts or questions before we move to pain management techniques, which we'll spend a good chunk on.
Okay, folks, I have this nifty little website. I can see when you open up your phone or by pressing *6, or when you unmute yourself. I can call upon you to talk to us, which we would really like. Okay, Chuck.
Hey, I feel like I'm dominating, but I'll try and be quick. One thing that I do with any type of medical appointment, whether, especially when we go to the neurologist, which is primarily to deal with dad's cognitive stuff. And I'm caregiver for my 92-year-old dad. I don't live with him. I live on the other side of town. I'm an hour away. So it's very difficult. But one thing that I do at all the doctor visits, I make lists of things that I've noticed since the last visit, and 2 copies, one for me to keep and one to hand to the doctor, or with the neurologist, I give it to the front desk and can you get this to the doctor so she can bring it up, because I can bring it up to dad. I don't know. That's the only answer I get a lot of times. But if she brings it up, he will engage with her more than me. And then I can sit behind dad and I'm shaking my head, yes, no, you know, whether what he's saying is true. So that's one thing I do. The other thing, challenges with being caregiver. Like I said, I'm on the other side of town. It's hard for me to say no to dad, but I have to, because a lot of my pain and injuries are from the last going on 10 years of caregiving for my dad. Him and mom were married for 60 years. And then she died and I kind of fell into the caregiving role, which is not a complaint. But I've injured myself caring for him. And it's like, if I don't, then he will try to do it. If I won't change the lawnmower blade, oh, I can do that. No, you can't, Dad, not anymore.
Mm.
So it's a challenge to let go of some of those things, pick my battles. And it's really, I don't feel shame, but I do feel guilt a lot of times.
Mm.
But the airplane thing, yeah, I got to take care of myself.
Yeah.
And it's hard.
Mm.
So,
And Chuck, thank you so much for sharing that. Once the session is over, if you have time, we'd really like you to stay, because that's a time where we can sort of have a little bit more of a personal one-on-one discussion. So I hope you do remain with us. Thank you.
And it was a great tip regarding giving the doctor a list.
Absolutely.
Mm-hmm. Yeah, thank you so much for sharing that. I think it really encapsulates a lot of the difficulties, but also you're giving a lot of solutions that have worked for you too. And that's something that I've done with quite a few patients, is even in their own medical appointments. So not even for someone else, right? You're talking about for your father in this case, but sometimes side effects from medications for pain can lead to a lot of brain fog, difficulties with attention, concentration. And so I've encouraged people to make a list of all the questions you have for your doctor for that day, everything you want to address, what side effects you're experiencing. And so that way, when you go in, it's with much less anxiety because you already have set out a goal for that appointment. So that's a great tip, not only for someone living with chronic pain, but maybe for the person they're caregiving for as well. And you mentioned also, setting boundaries, right? Sometimes saying no and prioritizing yourself because you're in a pain crisis or because it just isn't feasible in a given moment, and how that can lead to some feelings of shame or guilt that we talked about, and similarly to what the person in the email had mentioned. But how important it is to learn your limits and to learn how to be kind to yourself in moments where those limits need to be respected. And that's a big piece of some of the pain management tools we're actually going to be touching on. So thank you again for sharing. If there's no other comments or questions, maybe let's move to pain management techniques. Okay, so we'll talk about each one of these in some detail, but if you have any specific questions about them, we'll do that in the question period afterwards. So obviously, the first piece of pain management is seeking appropriate medical support, right? So the first step usually is talking with your doctor, with your general practitioner, and they might be able to manage your pain just fine, and that's great. They might need also to refer you to a specialist eventually, or they may need to refer you to a specialized pain management team or clinic. So that's your personal journey, but knowing that seeking medical support, as much as we're talking about the psychological piece, which is huge, there is the medical piece that is equally as important. And then also maybe seeking out psychological help, maybe involving yourself in support groups. There are some free ones that exist. There may be ones as part of a clinic that exists. So just checking in with yourself as to what your needs are as you go through your journey with chronic pain. Somebody in the chat mentioned motivating yourself to engage in activities when you can. And that's a big piece of living with chronic pain, is how to find the motivation to keep pushing forward. What does that mean for you? How do you actually find that motivation? And we'll talk a little bit about where that motivation can come from. But in moments where you are willing to do those activities that help, to just do them. Sometimes we wait until we feel ready to do something, this is a very mundane example, but it's sort of like going to the gym, I'll wait until I feel really ready and motivated to go. But sometimes the action just has to start and the motivation will follow. Sometimes you can unwillingly drag yourself into the gym. You're angry about it, you're mad about it, but then the motivation comes sort of once you're there. And so it's an interesting relationship with motivation, is sometimes you just have to kind of throw yourself into the activity if appropriate for your condition, but also accepting your limitations, right? As we've mentioned multiple times here, what does it mean to engage, to make a commitment? What will that take from you mentally, physically, and then maybe making adjustments along the way. So that leads us into the idea of pacing. This is a really important topic that I focus on with a lot of people. Pacing is basically knowing what your rhythm is, knowing when to start, knowing when to stop, knowing when to take breaks. So somebody gave me the example of gardening, and it made me think of a patient I was working with who lives with fibromyalgia, so widespread body pain that can be debilitating at times. And she was having a much better weekend and the sun was out. And so she decided she was going to garden for about 8 hours straight. And so what happened was, as much as she enjoyed the 8 hours of gardening, she was completely out of commission for almost a week after that. So we really had to take the time to talk about pacing, right? Maybe gardening for half an hour would be better, and then taking a half an hour break, and then maybe returning for another hour, and then maybe not returning for the rest of the day, right? You get less gardening, there's less joy, but perhaps that would have led to not a pain debilitating crisis following it. And that's not to say that there's any blame in it. It's just, it takes practice learning what pacing means for you. So typically what I tell people is pacing means knowing when to stop, and when to stop is not when pain starts to become too high. So you want to actually stop and take breaks before you're noticing that pain is getting overwhelming. So taking breaks as you still feel well, taking breaks when you still are able to tolerate the pain, and keep doing that instead of pushing yourself to the limit till you feel pain and you hit a wall, and then knowing that you may have to pay a lot of consequences after that. So pacing is extremely important when living with chronic pain, and also if you're caring for someone with chronic pain, teaching them how to pace, or maybe setting limits for them as well. Setting limits and boundaries, we've touched on this now, when you may actually have to say no, right? Without guilt. What does it mean to say, you know what, actually, I can't come over today to a friend, or, you know what, we had plans for me to host dinner and I just cannot go shopping for groceries today because I can't lift them. I don't have it's too heavy, it's too hard for me. Learning how to be flexible with yourselves and being transparent with others. Yeah, today is not a good day. And trying to be kind to yourself, and knowing that you're ultimately doing something good for yourself in that moment, but also for others, because you probably will not enjoy whatever activity you're doing with those people if you're in such a high state of pain. Self-care. So this has been brought up now, but what is self-care? What does that look like to you? We talked about self-care lists. So to give you guys a bit more of an idea of what this looks like, a recent survey was done on what activities caregivers use to take care of themselves. This was not, to my knowledge, of caregivers that live with pain, but just in general. And some of their most common responses were gardening. So we've already seen that is something people are doing. Crosswords or puzzles, exercise and sports, proper nutrition, socializing, spirituality, maybe religious involvement. So all of this is unique to you. You have to figure out what these activities are that bring you a sense of peace, of joy, of calm. They may include being with others. They may be more solo activities, but figuring out what are those hobbies that really are a sense of peace and calm for you. Sleep. Pain management, I'm going to return to this because it's so important. Pain management cannot properly happen without proper sleep. Now, not everyone needs the same amount of sleep or hours every night. Not everyone's quality of sleep is going to be exactly the same. But if you are noticing that you really are not sleeping for long periods of time, your sleep is broken, pain is waking you up from sleep, it's important to talk to either a doctor about this, maybe a psychiatrist about this, to get this managed, or a psychologist, either through medication, if that's appropriate for you, through techniques for sleep hygiene, which just means good sleep habits, learning to maybe stop using screen time before bed, lowering the temperature. Like, there's all different types of tools you can use to help your sleep that will look different for everyone, but it is something that shouldn't be neglected in order to best manage your pain. Exercise and diet. So, as much as pain in your body makes it difficult at times to do certain activities, we still need to move our bodies appropriately. So without causing pain, you know, if you don't use it, you'll lose it to an extent. And that is within appropriate boundaries for whatever condition you're living with, but finding ways that make your body feel good. If that's very basic physio exercises, then that's great. Do that as much times as it's recommended. A lot of people with chronic pain end up doing some sort of swimming activity because there's no pressure on the joints. They feel light. For some people, swimming is not appropriate because pain on the skin or pain to the sense of touch is not appropriate in the water. So it looks different for everyone, but figuring out what kind of lifestyle works for you in terms of your diet and movement is a big piece of pain management as well. We can move to the next slide now. So I'll go over these as quickly as I can, but mindfulness is a huge piece of pain management. We do a lot of these techniques at the pain clinic. Mindfulness is being in the moment. It's being present focused. Oftentimes we are very anxious, worried, or regretful about the past, or anxious and stressed about the future. We want to bring it to the present moment and sit with what we have here and now, whether that's in pain or in joy, whatever it is, making space for your here and now. And the way that we often teach this is through breathing and visualization. So I'll just give you a brief example. I'll typically teach people to deep breathe by placing one hand on their chest and one hand on their abdomen, and trying to lower your breath into your diaphragm so that your hand on your stomach goes up and down instead of your hand on your chest. It may be hard to visualize for those not looking at the video, but the purpose of this is to try to deep breathe, which is actually quite difficult and takes a lot of concentration. But as you focus on deep breathing, your attention is brought to the present moment. It's brought to your body, it's brought to your breath. And then with that breathing, you can engage in visualization. So for some people, they'll visualize being in a safe space. Maybe that's the beach, and go into what you taste, what you smell, what you see, what you hear at the beach, right? And breathe as you're visualizing this. For some people, maybe you want to revisit a really positive memory as you breathe deeply. For some people, maybe you do deep breathing and you put on waves of the ocean sounds before bed to help sleep. So mindfulness is an important piece of helping yourself in a pain crisis, or for sleep, or to calm the nervous system. Values are things that add meaning to our lives. Basically, everyone's values are different. So examples of values can be spending loving quality time with our families. A value could be integrity, honesty, hard work, determination, self-care. Whatever value you have at your core, learning to engage in those value-based actions on a day-to-day basis is really key. So for example, if your value is family, maybe you're having a really bad week with pain and you cannot go out for dinner with your family. You cannot invite them over, but maybe you can make space and time for a 5-minute conversation with a family member, or maybe you can write someone a note before they leave for work, right? So as much as you can do, engage with your values in terms of concrete actions in your day-to-day to feel a sense of meaning despite pain. Self-compassion is also a really important part of the work that we do with people that live with chronic pain. We've seen now from the email, people that have shared that guilt comes up. There's like a sort of negative inner dialogue that can be evoked with pain, right? Maybe this voice that says you're not good enough, you should be doing more. Why didn't you do that today? You'll always live like this, right? So these are examples I'm giving you from patients I've worked with, very negative, very punishing, punitive voice that people might have with chronic pain. And so it's learning to maybe talk to yourself in the way that you would talk to a loved one or a very close friend. Maybe it's changing that narrative to, I'm doing my best today. I'm giving 100% today, and 100% is only 50% today, and that's okay. Or, I'm going to allow myself to feel this for an hour, and then in the next hour, I'm going to change my mindset, or tomorrow is a new day. Whatever that might be, learning to engage with yourself in a compassionate way is going to be a big game changer for a lot of people's mental states. Lastly, we talked about socializing and remaining connected. So because chronic pain can be such an isolating experience, it is important to connect with those that you feel safe around, maybe those that understand you. And maybe it's connecting with other people that have chronic pain in some form of a group or online communities that exist. And lastly, it's reaching out for assistance. So a big piece of self-care is having the courage to say, I need help. And maybe I need a bit more care medically, psychologically, socially, and vocalizing that takes a lot of courage and vulnerability. So on that note, I just want to say that chronic pain is a very difficult condition to live with, especially with the stresses of caregiving on top of that. There are tools that you can help yourself with, that you can help your loved one living with chronic pain with, and ultimately everyone's journey managing their pain and their caregiving will be very unique. So it's important to try things out and see what works best for you.
Wow, what a lot of great information.
I know that we're coming to the top of the hour, but there are resources available in the next slide. And I think Evelyn has a little piece of housekeeping to do. Just to remind you that Jenna and I will stay on. The recording will be stopped. We'll take maybe a 2-minute break to go to the bathroom, and we'll be right back. So go ahead, Evelyn.
Well, I understand that Jenna is going to share her slides. So I hope you folks didn't take too much time writing stuff down. We're very happy that you're doing that. And it was a great presentation, Jenna. Thank you so much. I learned a great deal of things. And to those of you who gave us information about what you do, it always helps everybody so much. I want to let you know that we're going to send out a post-session questionnaire in a couple days, and it will ask for your, to review what we've done and make any comments and suggestions that you have for how we can improve, or topics for the future that you might like us to present, to find a presenter for. Now, you'll also get the slides, and it will include those resources with your post-session questionnaire if you've registered. So if you got this number or this link from someone else, please call our customer service person and register. And that number is 866-390-6491, 866-390-6491. And I always feel like this is a little bit like an infomercial, but in addition to getting that post-session questionnaire and the resources, you will also today get the monthly calendar. And that monthly calendar is pretty great. The staff works hard putting together experts on a variety of different topics. We have many very interesting ones yet to be presented this month. We've got 5 left. We've got polypharmacy talk. We've got one in Spanish that's a guide to survival during caregiving for Spanish speaking or anybody who's was their primary language and they'd like to hear it in Spanish. We want to have one on, my aging parents, anxiety and unhealthy thinking patterns, which should be interesting. We've got the Conversation Project, which is tips for talking about wishes for care through the end of life. And at the end of the month, we have Emotional Intelligence Institute, Caregiving Through the Lens of Self-Awareness with Jamie Heisman. Now, we also, on Wednesdays this month, and we've already gone through a few of those, but we have the LGBTQ plus caregivers, for caregivers on how to, for Pride of Caring. And the 2 we have left is Alzheimer's, dementia, and the community and mental health among that community and caregivers. So we have just an amazing array of items for everyone. So I want to thank you so much, Jenna and Lucy. You're always the best. And I want to thank all of the participants for your input today, for being here, and for what you do every day. And I also would like to thank the Wellman Charitable Foundation for all of the supports that they're giving caregivers throughout the country. We have people all over the country listening to our podcasts and to our Zoom calls and telephone calls these days. So it's pretty wonderful. And with that, I will say goodbye to all of you and thank you so much.
Thank you, Evelyn. Thank you so much.